Echo.
Thank you, Mr. Speaker. My question is to the Minister of Health. Sam Patel owns the independent Keswick pharmacy in my riding. He delivers to seniors, he holds clinics, and makes up orders for nursing homes. Now, with your cuts to frontline medical care, he will have to cancel each of these special services, and Sam is not alone. Pharmacies across rural Ontario are in the same boat, and many will be forced to close, depriving thousands of needed medical care and advice in their communities. Why are you trying to cut access to the frontline care that pharmacists like Sam offer to my constituents?
Minister.
Thank you, Speaker. I welcome the opportunity to talk about this. The first thing I want to say is that this is all about improving access to drugs for people of Ontario at a fair and lower price. We are committed to supporting access in rural areas. We have put $24 million into our plan that we will invest in pharmacies that provide that vital access to pharmacy services in their communities. Speaker, the other thing I want to make very clear is that we are committed to paying pharmacists directly for services they provide to customers. We want to pay pharmacies for providing those vital services to pharmacists. That is also part of our plan. So I would urge you to speak to your constituent and urge that pharmacist to embrace the new way of doing pharmacy services in this province by enhancing the services they provide, and we will.
Supplementary.
On Monday, you told this House that we had to make a choice between pharmacies and patients. This is a false choice. Pharmacists like Sam Patel are frontline healthcare providers. They keep my constituents healthy and out of the hospital. You are more interested in spending healthcare money on your e-health boondoggle and consultants and salaries at the LHINs instead of local healthcare. And then, when you are questioned, you attack pharmacies. Will you explain to Sam Patel why he should have to cut services and possibly go out of business?
Speaker, we want him to provide more services. We also want to, on behalf of the people of Ontario, get fair, lower prices. Let me give you another example. There's a drug called pantoprazole that's used for acid reflux and peptic ulcers. Currently, a person would pay around $536 for that drug. Under our proposed changes, the person would pay $178 for that drug. That would be a savings for that person of $358. Speaker, we are paying too much for drugs in this province. I would put the question to pharmacists. Please explain why Ontarians are paying so much more than people in the United States, in France, in the United Kingdom. It's a remarkable inflated price we're paying, Speaker, and we're on the side.
Member from Welland on a point of order.